welcome and thank you for joining us here on The Factor Uncensored. What do you think? Should mothers face criminal punishment for using illegal substances during their pregnancy? Some doctors believe the answer should be no. There are some drugs out there that could actually both help the mother and the child, but also some say, and as we know, there are drugs like crack and meth that could destroy them. Now, doctors like Noral Volkov from the National Institute of Drug Abuse argue laws that criminalize women are pregnant and taking drugs be removed. They don't want those women criminalized. Texas is one of multiple states that considers substance use of any kind during pregnancy as child abuse. Let's talk about it. Joining me now here on The Factor Uncensored in the studio, the founder of the Coalition to End Fentanyl Poisoning and Opioid Overdose, Doctor of Psychology, Katrina Forte. Glad to have you here on The Factor Uncensored. So how big of a problem is this with pregnant women getting accused and then eventually charged with drug use?
It's a big problem. It causes problems on several levels, to the extent that some women are afraid to seek medical care while pregnant because they do have substance use disorders.
And so are many of them or some of them sentenced to jail time and they're in jail pregnant as well?
That is correct. More recently, Texas has implemented the drug courts and has extended that to pregnant women. So we have seen a decrease in that in Texas.
And when we talk about women, do they typically come to the table when they're pregnant already addicted, or do they started after they're pregnant? How does that typically work?
It varies. Typically, they're already addicted, or they're involved in human trafficking and they're placed on drugs forcefully. So it's typically not a situation where they start drug use once they're pregnant. It's typically they are already on drugs before the pregnancy, and they don't know they're pregnant in a lot of the cases.
And if you have someone who is pregnant and on drugs, and before it gets to the courts where they're facing criminal charges, what would you tell their family members, their significant others, their loved ones to do if they see like a mom smoking marijuana or smoking crack while she's pregnant? How should family members, friends address that problem?
Reach out for help. Let the person know that there is help available. I know here in Houston, Santa Maria, Ben Taub, and the Council on Recovery offer programs like the Cradle program that help mothers that are substance use users.
And if a mother is on drugs while she's also pregnant, is there any type of rehabilitation program that would also be safe for the child that she's carrying?
In terms of medicated assisted treatment, so the studies, obviously we can't do them on pregnant women, so it's limited like other kind of drugs. So there's no known safe usage, but it's risk outweighs the benefit, benefit outweighs the risk kind of situation there.
And how fatal is this situation if you're dealing with a woman who's on drugs? Have we seen many instances where the child will come, may not come, and may be killed as a result, or may die as a result of the mother abusing drugs while pregnant, or come out with some type of defects?
Absolutely. Unfortunately, the percentage of mothers that are addicted to opioids pregnant, the overdose rate is higher than non-pregnant women that are addicted to opioids.
And when the children are affected and the mother's pregnant and the mother's using drugs, what kind of birth defects could we see there?
It just depends on what the drug is. So you have fetal alcohol syndrome the child could have. They go through withdrawals very bad where the child then has to be placed on medication as soon as they're delivered to continue to kind of wean that child off of cocaine, crack, various birth defects, developmental, neurological, and these are lifelong problems that are a result of that use.
And we've seen some children born addicted.
Absolutely. About 2/3 of addiction is biological. So, you see this.
Now, what do you mean by that? 2/3 are biological?
So when you're dealing with something like substance use, you have a big pie of what contributes to if someone's going to become addicted later on in life. You have biological, psychological, and social. And so 2/3 of that piece of the pie is biological. So if you have someone that had a parent that was a substance use abuser, addicted, or the correct term is substance use disorder, there's a 2/3 vulnerability for that child.
And we've seen also in the future learning disabilities.
Yes.
As a result of a mother using drugs while she is pregnant. What kind of disabilities do we see that manifest themselves in the classroom for that child as a kid?
A lot of the times you're looking at attention deficit disorder, ADHD, attention deficit hyperactivity, things like that. That's more so what you're seeing in conduct disorder.
But bottom line, you think women who may get hooked on drugs while they're pregnant, they shouldn't be charged? Or exactly what are your thoughts on that?
My thoughts on that are that we do need to find another way than historically we have taken a punitive approach towards drug use. And maybe a more treatment-focused continuum of care, provide services for someone trying to get pregnant that is pregnant and after they get pregnant. That would be a better approach than just, sending them to jail and separating families.
All right, Dr. Forte, thank you for joining us.